Okay, hi. So Jeff Shrimpton here, introducing Kate Bunyan. Kate, can you just say hi? And we're going to talk about coronavirus today, and I know that's something you've probably been talking about quite considerably over the last couple of weeks. Can you just, I mean, I know your credibility, but can you let people know so that they know that they're talking to an expert right now, what your experience is and what you're currently doing for work?
Yeah, absolutely. So hi there, everybody. My name is Dr Kate Bunyan. I'm an A&E doctor by background, but I have a slightly unusual portfolio career. So I am a small business owner. I run a medical events company and first aid training company. And I'm also currently the Chief Medical Officer for a company called Dr Care Anywhere. And we're the single largest provider of virtual digital consultations in the UK for both general practice and integrating into secondary care. I also have a background having worked in the cruise industry doing a lot of environmental and public health medicine. So I have a very unusual combination of factors that brings me to these conversations about coronavirus, because I've managed pandemics before from the cruise industry perspective. So I've managed it from a business perspective. I'm a hospital-based doctor. I know what it means to actually be treating patients in a situation where you feel overwhelmed. I'm a small business owner, so understand the pressures that that brings on what we're doing at the moment and the measures that the government are having to introduce. But I'm also a clinician that's running a medical service that's trying to support the country and support all the efforts of the NHS.
Great, thank you. I know how modest you are. That's probably a little uncomfortable, but when I spoke to you last week, you were just going to Sky TV's offices to do studios to do an interview. You've done a few interviews as well, haven't you?
Yeah. I think I'm up to about a dozen TV interviews now, and probably a few more than that in radio interviews. So yeah, I've got some more planned in for this week as well.
And the reason I just mentioned that is because people are looking to you as an expert. So, because the reason that I want to establish your credibility is because there's so much stuff out there right now. And, you know, the reason I wanted to interview you is so I could point people in the direction of someone to listen to. Like, listen to
Thank you.
this person, stop reading stuff on Twitter.
Yeah.
And I think
Thank you very much for that.
we should probably start there. And there's so much stuff going around, and you know, I'm on WhatsApp groups and this, that, and the other, where it seems to me that lots of people are just sitting there on social media, looking at the next development, the next rumor, the next hypothesis, and not knowing what's right, not what's wrong, what's the truth of the matter is, and probably getting themselves into a bit of a pickle.
Yeah, absolutely. And we are seeing that amplified and having real negative impacts on people. So what I would first of all suggest is that choose your one or two trusted outlets of where you're going to go to for what you know and trust to be facts. I would recommend the WHO website. I would recommend the Public Health England website and NHS websites, because those messages are clear, they're consistent with each other, and they will provide you the information that's updated as and when we know it. The difficulty we have in this day and age that we have never experienced in terms of pandemics before is the amount of news generated and the number of news outlets that are out there. And social media is playing a part in that like we've never seen before. So we're bombarded with information sources, and we, in our daily lives, have a lot of different information sources that we'll pull upon for different purposes. Some because we like a bit of light-hearted entertainment, some because we're looking for that social connection with people, some because we just want the gossip. But the challenge is now working out when those information sources are also sharing some factual information that can help to reassure and help us to manage ourselves in this situation, and when they're also just adding to the hype, and filtering that out and being really consistent and tough with yourself in only going to those reputable sources that you've decided to make use of really does help to control the anxiety that it's driving for people, as people have a thirst to know what's going to happen. And we have to recognize that not everything is in our control, and that which isn't in our control does tend to drive fear and anxiety, and that's not going to help us at this point in time.
No. And fear and anxiety creating probably some mental health issues as well, I would imagine.
Absolutely, and the WHO and NHS England have recognised that certainly with publications of various pieces of research about what the impact is and guidance on how we can help each other. And really that's where the messaging comes from, around choosing reputable sources that you trust, and they'll be different for different people. but also helping to reassure and not add to the hype. Recognizing that fear is something that's really important to us. Fear drives us to good decision making, but fear, when it's allowed to get out of control, or fear of that which we can't control, starts to become really damaging to us. And at the moment, we're all going to need to be at our finest. We're going to need to be mentally strong. We're going to have to find our resilience. And we know that that has an impact on our immunology. So it affects how well we stay fit and how well we manage infections in ourselves. So it's a really virtuous circle if we get it right, but it can be really vicious if we don't.
Because technically, if you worry about it more and become more anxious, you're more likely to get it because your immune system's down, isn't that right?
Yeah, absolutely. So it is important that we look after ourselves, that we do stay fit, active, and do all the things that we would normally do, and help control and manage our emotions and our resilience. And this is the biggest test of our resilience that we've seen in this country in a long time.
Because I think some of the problem as well is that people are starting to feel that they're being played by the media, or there's just a whole load of noise coming in social media. People are really aware of that. And in some cases, they're now rejecting it and going, oh, it's kind of hype. It's just social media. It's the media trying to sell us a story. It's not as bad as we think. We'll probably be going to be okay. What would you say to that?
I think it's really understandable that people want to reject the hype. But I think what is also difficult to comprehend is the numbers involved. So we know that for the vast majority of people who become infected with the virus that causes COVID-19, the coronavirus that we're talking about at the moment, they will make an absolutely fine recovery from a relatively mild illness. But we know that in certain groups of people, they are more likely to get more significant illness than in others. So we know in the elderly and those with other medical problems, there's a higher rate of ending up with severe illness, and there's a higher rate of dying from this. That doesn't mean that even in those groups, it's not more likely that you'll have a minor illness and recover. And when we're talking about the statistics, that is a really useful story to be able to look at. But when we apply the statistics to the whole population, and we recognize that nobody has immunity to this until they've had it, that's a very different situation to any that we've been in with infectious illnesses in the last 100 years. So the difficulty that we then have is that small percentages of a large number are still a lot of people. And the human factor part of that is that we will all find that we do know somebody who has been really affected by this virus in some way, and not just economically, I mean, from a health perspective. And that's when the stats don't help us understand and balance what we need to do from a human factors perspective. There's no doubt that if we don't pay attention to the simple measures that we can all apply at the moment, washing our hands, thinking about how we're doing our coughing, using tissues, keeping distances, and isolating ourselves if we're not well, that will have an impact on being able to reduce the impact of the illness. We know that if we have enough NHS resources to deal with the seriously ill, more people will make a recovery. But what we've seen in countries that are further along in this pandemic than we are, is that those health services that aren't able to cope have to make some really difficult decisions about who can and who can't get healthcare. And you've probably all seen the graphs going around at the moment of what it means to have a very steep peak and get this over and done with really quickly, versus if we can delay the process, spread it out more, prepare the NHS better, and see more people survive this, because actually we can manage that peak in a much more gradual fashion. And that's really what we're talking about with all the measures we're putting in place at the moment. It's being able to spread this out so we lower that peak and help more people have a chance of receiving the healthcare that they're going to need to make it through this epidemic.
So there's a lot of talk at the moment. And actually, I meant to say this at the start of the interview because things are moving so fast. It's worth saying that today is Sunday, the 15th of March, because somebody could be listening to this in a week's time and everything we talk about could be completely irrelevant. So
yeah, absolutely.
15th of March. So we've just moved from containment, I'm told, to a delay tactic. And there's lots of thoughts of Italy and lockdowns and things like that. Is lockdown, whatever that looks like, is that the next stage? And what does that mean?
So there are various measures that are put in place to help contain a pandemic. In the UK, we have 4 levels, if you like. Containment is where we were until Friday. We're now in the delay phase. The next phase for us is mitigation, and the fourth that runs along through all of them is research and development. The delay phase is exactly what it says on the tin. It's the process of introducing measures that help to delay the peak of the epidemic within the UK. So it's pushing it out further towards the summer, when we know that the health services are under less strain ordinarily than they are over the winter period. And it's also allowing more time for the health services to increase their surge capacity. What we're seeing in Italy is a very different scenario, where people feel that they have rushed into that very steep peak and are now trying to enforce as many social distancing measures as they can. And the easiest way of enforcing social distancing is just to enforce an absolute lockdown on people's movements. But that has really significant impacts to the economy, to people's well-being, to the support of those who are more fragile and more vulnerable in society. So balancing the current science for our economy and our situation, the epidemic as we're seeing it in our country, is really important when the government is taking the decisions it is about what steps and what measures we need to implement in the UK. So what will we see next? Well, those we're hearing a lot about in the news, whether that's cancelling mass gatherings, whether it's changing what sort of transportation we can take, whether it's encouraging certain groups of people to remain socially isolated from people for a prolonged period of time. We don't know exactly what will be put in place in the UK, but we can see from examples around the world of what sort of measures different people are putting in place. And we have the great benefit of being further behind people and able to learn from what we're seeing around the world, what has worked, what hasn't, and put things in at the right time for us and the situation that we're in at the moment.
So there's, I know I'm going to try and avoid too much asking you to look into your crystal ball, but with that extra learning, is there a good chance that we can have a better experience of dealing with this than say Italy?
I think so. I mean, definitely the measures that are being required of us at the moment are all designed to help flatten that curve, push us further along, and make sure that we can have a healthcare system that is ready and prepared to deal with whatever comes its way. So washing our hands sounds trite if you keep saying it too often, but actually it is really important. 20 seconds of proper hand washing, not dabbling your hands under running water, will make a difference. Making sure that we are disposing of tissues properly, that we are keeping apart from people, and that we're following the advice that if you feel unwell with a new persistent dry cough, or you've got any fever from any cause, that you self-isolate for 7 days and follow all the advice and instructions that are available on the internet, on the WHO's website or on the NHS website, so that you know what that means to self-isolate at home. Following that really will help us to improve our overall chances of success of managing this epidemic as best as possible as we go through the next weeks and months.
But whilst I think I feel buoyant that we've got the learnings from Italy and ahead, and we might not have quite a disruptive situation, it's still got some legs on it, this thing, hasn't it? And it's going to come through.
Yes, it has. Absolutely. We saw swine flu and the pandemic H1N1 influenza, but influenzas are something that a lot of us have some degree of immunity to, so some degree of protection. And that's thought to be one of the reasons why that epidemic didn't become quite as significant as this one is proving to be. But we also know that that in itself killed thousands of people in the UK and across the world. So we can absolutely anticipate that this is going to be life-changing, not only from a healthcare perspective, but also in terms of the economy and what this does for long-term changes in the way we work and the way we relate to people moving forward.
I think thinking about businesses and the economy, it looks like the leisure industry is going to suffer probably the most, whereas industry itself needs to carry on, doesn't it? And the priority will be to getting rid of fun and keeping work going. Is that probably a good estimation of what's going to happen?
Yeah, I suspect so. I mean, anything that is considered discretionary and that makes it more difficult for social isolation, you can imagine being top of the list of things to close down. But those are the same things that also add to our mental well-being, that add to our resilience. So it is a difficult balancing act. Taking all of those things out too early in this process could actually see a much bigger impact on people's well-being further down the track. So it's not as simple as just saying, well, we'll just introduce all these things now, close it all down, and everything will get better, because it's a complicated balancing act.
But things like construction sites, for example, is there any reason why they would stop and slow down?
No, there shouldn't be, but I think what we'll be learning more and more about is the supply chain network, and understanding what it means to be able to keep going when different parts of the supply chain are affected. And some of the quotes being put around at the moment is that as many as 1 in 5 members of the working community could be off sick at any one time. And if off sick means 7 to 14 days, then that's a significant part of your workforce, whatever sector you're in, that's out of action. And that will have impact on production lines, that'll have impact on being able to run through work, and it will impact decision making. And so I think whilst we might be able to ordinarily say, well, construction sites or manufacturing plants won't need to close, they won't be subject to the same working from home requirements that might come through, how they can operate with reduced workforces and how they're impacted by other people's reduced workforces as part of their supply chain or onwards chain, that'll be really telling for people. So understanding now who your critical suppliers are and what their business continuity plans look like, understanding who you are a critical supplier to and which your endpoint are going to be really key things that you can do now and keep in your control to help work out how you weather this storm, and how you put things in place to assure that you can continue to do your work and deliver your services in an effective way while we are experiencing unprecedented restriction.
Well, I think much like the disease itself, in terms of business, it'll take out the weak and the sick, won't it? In that respect, of businesses that aren't strong.
I think it will take out those that aren't prepared. So although I think you're right to say weak, I think weak doesn't have to mean big. I think there can be some real successes for small businesses that are prepared and take some time now to just understand where they sit within their supply chain, and understand how they can continue to do the work that they do, how they can diversify, what they can do to mitigate payment restrictions over the coming weeks and months, how they tap into the budget changes that were announced last week, how they can make use of that, keeping in touch with those people, and also thinking about what they can do more broadly in sort of that more social sustainability sense that can give them real self-worth while we're going through this process, which stands them in good stead to pick up again, even if things are tough over the next few months.
Well, you know, we've had coaching conversations before, Kate, and you'll know that excuses are discouraged, and that falling on your sword and using coronavirus as an excuse is not going to work for people. I get a sense that in some cases, because of the fear and the panic, people are going to. So some people will be like freezing like a rabbit in the headlines, and what they need to do is innovate. They need to increase their marketing activity, because if a couple of projects are going to drop off, they need more irons in the fire. They need to innovate how they deliver their service, how they win business, be creative in all aspects, and be sensible.
Absolutely. And I think it's at times like this that innovation happens without it feeling like a thing that you do, because actually the ability to look around you, look at what is happening in other sectors and say, actually, I've got a solution for that. I've got a way of being able to manage that. And it might be that at the moment you think about what you can give to support others, and work out how you monetize that later down the track. But being a strong and trusted brand that comes through this as people to rely on to help keep things moving will be really important when we get to the other side of this.
So some tips on keeping customers, keeping staff safe. Obviously, we've talked about washing hands, having anti-bac gel, if you can get hold of any of the bloody stuff. Amazon have not got any available for several weeks. If you're a retail environment, especially if you're selling food, that kind of thing, having gel outside the house, outside the shop, as people come in will be advisable. A client of mine has got that and they put on the door. And I said to them, you need to insist that everybody uses it on the way in. I said, no, and he said, no, I don't, because everybody is. Everybody comes in like that. So people are getting it. I'm surprised that some of the high street retailers are not having gel dispensers on the way in, where they've got, you know, fridge doors to open and all that kind of thing. Maybe they'll catch up with that. What about handling cash as well? Might it be an idea just to use cards?
So I think, first of all, on the hand washing thing, I would remind everybody that hand washing with liquid soap and water is by far the best thing you can do. Hand sanitizers are a useful second, but they only work on clean hands. So actually, the physical activity of washing your hands in soap and water should still be the mainstay of what people do. So if you don't have access to any hand gel, don't panic. Liquid soap and water is still going to be better for you than just using hand sanitizers. But thinking about how you clean your frequently touched surfaces, or how you take over and control frequently touched surfaces. So if you are in an organization where ordinarily customers would handle lots of different things, now's the time to think about taking away the things that they can handle and handle them for them. Demonstrate things to people rather than let them demonstrate themselves. If it's difficult to clean what you've got in front of you, then work out how you manage the risk differently. There are lots of examples. So I come from the cruise industry, and we have a lot of examples, and you can Google that quite happily, of ways of which you can decrease the likelihood of cross-contamination, and by cleaning things, by reducing the number of paper leaflets that are around. So the cash thing, yeah, use contactless, then you're only touching your card and you can keep your card clean. But if you do need to handle cash, wash your hands afterwards. The key thing is about not putting dirty hands or contaminated hands near your face and your mouth, your eyes. So if you can remember to wash your hands and then do whatever you're going to do, then that's still safe. So we don't need to stop using cash. We just need to think about what we're doing when we're using the same surfaces that other people are touching, and keeping ourselves clean so we don't put ourselves at increased risk.
I think the population is suddenly realizing how often we poke our eyes and put our fingers in our mouths and things.
Yeah, absolutely. Biting the sides of your fingernails, wiping your eyes, rubbing your contacts. Now might be the time to move back to glasses.
I've noticed people even putting their fingers in their mouths while standing on stage in front of TV cameras, telling people not to put their fingers in their mouths. So
it's really difficult when you start thinking about it, but now's the time to be doing that. Now, when we're working out how we put all the measures in place, now's the time to get used to changing our habits.
So Kate, have you got some resources that people can look at for policies that they can put in place for keeping their work, their workplace, their staff and their customers safe? Is there somewhere they can go and get that information?
Yeah, if you go to the .gov website, which is the home to all the Public Health England information, they have some great guidance there for businesses. Now, what I would say is that as I sit here on Sunday, it hasn't been updated with some of the latest information that came out on Friday, and I would expect that will change again tomorrow. But it does give some really useful information about what to do if someone in your workplace is sick, what to do if you become sick in the workplace, what to do if you know of somebody who's sick, how does that relate to your workplace? And the key thread that runs through all of it is, if you're unwell, you self-isolate, but if you're not unwell, in and of itself, having known somebody is not enough to put you or your business at risk. We're talking about close proximity, and close contacts is being closer than 2 meters for more than 15 minutes, or having been directly coughed or sneezed at a distance that is closer than 2 meters. The 2 meters is important because these droplets that we're talking about, so the virus is spread by respiratory droplets, so coughing, sneezing, and indeed breathing, sort of let all sorts of droplets out. Those droplets are actually quite heavy, and they will fall to the ground or fall onto surfaces in less than 2 meters. So that's where this 2 meters bit comes from. It's the fact that beyond that, actually somebody else's droplets won't get to you. So keeping that distance, but also close contact means being near somebody for more than 15 minutes, because that's the likelihood of where the time starts kicking in, when you're more likely to have been exposed to something. Or I think it's pretty obvious if somebody's coughed or sneezed directly into your face that counts. But other than close contacts, just having been in the same building isn't a risk. Our surfaces are contaminated with cough and flu viruses all the time. So cleaning our workplaces really thoroughly and regularly but just with standard means of doing so, so standard antibacterial wipes and things, that really will help enormously to keep your workplace healthy. And again, that information is all in the Public Health England website. You can then also find some additional information. So I know the CIPD are starting to put out information for HR directors on how they can help support workplaces, and thinking about things like your HR policies. So thinking through what you've got in place for sickness, what you've got in place for carers leave, what you've got in place for supporting home working. What are you going to do if people need to take carers leave but want to say, but I can do a bit? Actually, is it in your interest to make them take that as carers leave? Can you afford to keep them working even if the productivity isn't quite as high as it would normally be? Are you actually going to replace them in any way? Or do we help everybody by being a little bit more lenient than we might ordinarily be, and a bit more supportive to our teams if we can afford to do that?
So is it possible as well that some of us have had it and don't know it?
Yeah, absolutely. So we now know that there are more cases in the UK that don't have a travel connection than do. And that means that there are people out there in the community that will have been exposed because the ones that we know about don't have a link to travel. So they got it from somewhere. One of the things that we know from the studies done in China and in other places is that you can have very minor symptoms. You can even have no symptoms and still have had the illness. We believe that children might be carriers for this, so that they may get no symptoms at all, but also still have the virus. But fortunately, they're not seeming to be affected particularly by it. So it is possible that out there are a lot of people now. And by a lot, I'm talking about hundreds at this stage rather than tens of thousands who have had the virus but don't know it, and therefore will be starting to build their own immunity to this.
So, Kate, there's services like the ones given by your company. Now, I know you didn't come on here to promote your company, but it would be, it's a benefit for people to know about services like that. Can you just explain, how people can make use of video doctors' appointments rather than actually going into what people think is a hotbed of disease, i.e. the doctor's surgery?
Yeah, absolutely. So, yeah, thank you for that, Jeff. My company, Dr Care Anywhere, provides video consultations with GPs, and that's a service that we provide both through corporate packages for organisations that have corporate medical insurance, through organisations like Perkbox and eDays and stuff, but you can also buy individual packages. But one of the things that we're working really closely with GPs on at the moment is that there's been a move for the last few years to say that more and more GPs will move to what we call digital first. So the opportunity for patients to have their first interaction with their GP or their GP practice through some form of digital medium, be that video or telephone call. And that was already going to be in the pipeline over the next few years. We're seeing a massive acceleration of that to put that into the hands of all GPs in the coming days and weeks. And that means that GPs are also needing to come up to speed quickly with what that means to deliver safe consultations through video for their patients. And we're seeing loads of tech companies providing the means to do that safely, and they're providing that for free. So we've seen that from a variety of different healthcare tech companies, as well as companies like Microsoft. So there'll be increasing opportunities for you to be interacting with your own GP services through video and telephone. And what I would say to people is absolutely jump at the chance. So don't be nervous about having that as a means to communicate with your GP. They will know how to do that safely. They will understand what they can and can't treat well over a digital platform, because not everything can be done without actually examining a patient, but there's a lot that we can do, and there's a huge amount of resource, guidance and reassurance that we can give both to GPs and to patients about how to handle video and telephone consultations successfully. So whilst there are companies like mine and others, there's also going to be a lot more of that being seen within your own GP practices and in your own hospital care as well, looking at outpatient appointments being delivered through digital mediums as well. And I would just encourage everybody to take that as an opportunity if that's what's presented to them.
Great, thank you. So let's finish on a positive note, because I saw some wonderful videos of Italians singing together and playing their accordion, singing traditional songs from the balconies to entertain each other. I saw another one today of a PT instructor who's on the roof of the building, getting all the people around him doing squats and jumping up and down and giving them a workout whilst they're in their apartments. And I think there's a real opportunity here for people to come together and support each other, and there be a spirit of collaboration and support and help, and dare I say fun, and getting together, and maybe not getting together in person, but getting together emotionally to support and help each other. And I always say that life without problems is like a gym without weights, and that you don't get any stronger. And we will survive this. We will come out the other end, won't we?
Yes.
Yes, good. Thank you. And let's hope that we come out of it stronger, more unified, more collaborative, having innovated and created some wonderful stuff.
Absolutely.
So Kate, thank you so much for taking the time on a Sunday evening when you've had a million conversations like this a week. I really appreciate. If you do watch the video back, I'll need to apologise to you slightly, because I think the internet, my poor internet, meant we're a little bit out of sync. But the conversation was, you were talking so much sense, I didn't want to stop us there. But thank you very much for your time. I really appreciate that.
Thank you.
Let's hope that we will contain this and we'll push on through, and it won't be as bad as maybe everyone thinks.
Fingers crossed. Thanks ever so much for the opportunity, though, to chat tonight, Jeff.
Thanks, Kate.